You're listening to Where Before Meets After.
What's on the horizon? I heard yesterday that there's some really interesting things happening with fat in terms of products that are filler that are made from fat.
My boy, Dr. Johnny Franco, was he in here talking about that product?
I think it was Adam.
Alaclay?
Yeah.
Alaclay.
Yeah, Alaclay is a product by Tiger Medical. And what they do is they take cadaveric fat, they process it, and it looks like fat, like you're ready to inject it. And it comes in syringes. It's sterile. It's not immunogenic, totally safe to inject. But the advantage to it is if you have small areas to augment, you can use this as an alternative to doing a surgical procedure where you have to use liposuction to harvest fat and then process it and then inject it. So for small areas, it's easier on the patient and may even be cost effective.
In the problem, we're trying to body balance people. Either we have too much fat or we have too little fat. And sometimes if we're really strapped for fat, this is a great option because there have been times where you say, if we're trying to target, maybe get around her hip dip. I don't think implants are a great option for that. And there have been many times where we just said, look, in the US, we really don't have a good option for you. I wish I could offer you something, but it's just not here yet. And now it seems that is at least becoming more of an option. I think the important point about Alaclay too is just to point out it is FDA-research approved. We're actually going to be one of the people are going to be able to offer it early also. But we have that conversation with people too. Hey, this is FDA-research approved. So when people kind of ask you, what are the negatives that could happen? I just very honestly and bluntly say, that's why we're testing it. You're giving me that look, right? Like it's a little bit of a moment.
It's early.
Yeah. It's a little bit of a moment. You kind of sort of step back. You're like, oh, wait a minute. That's why I'm getting this tested on me. Do I want to go through that? And some people, just like anything on risk, do you put all the money down on roulette, or do you not? Do you let it ride or not?
I'm so old. I had a friend get Restylane in her lips before I even had heard the word Restylane. So, what year was that? 2003?
Yeah. Well, go back to about 1965 or so. There was a very brave woman who got
breast implant.
The
Timmy
first
G.
breast implant.
Lindsay.
Yeah, that's right.
I've written about her many times.
Crazy,
She's
right?
one of my heroes.
I stop and I think about that, and it's just so interesting because then you think like there are businesses that will fly you up into a plane and push you out of there with a parachute on, and you sign up for it. So it's just amazing the will of human beings to try things that could potentially have very adverse complications, and we are all better because of it. Pretty well.
But the thing is to do it in a controlled and safe fashion.
All right, give me your Instagram, your website, and where to find you.
EpsteinPlasticSurgery.com. And our Instagram is dr.mark, M-A-R-K, Epstein. You can find me on Long Island in Hauppauge. It's in Suffolk County.
And I am a SoCal plastic surgeon, Matt Nykiel, in Newport Beach.
Thanks for listening. I'm your host, Eva Shea. Follow the show and submit questions for our experts at wherebeforemeetsafter.com. Where Before Meets After is a production of The Axis.